tonight. I want to thank Plan Mecca for hosting us in this beautiful new facility. If anybody gets a chance to come by and visit them when you're in Chicago, I would highly recommend it. That's a wonderful new facility. So my vision for this event is to bring together the dental sleep medicine, Airway, TMD, and pain worlds together. And most important, to bring them together to create a hinge point in dentistry. This is where dentistry starts to get a lot closer to its full potential. I will be touching on just a few of the topics. So expect to have some questions, expect to want to find some answers after this. So I'm here to talk about a mindset that's going to get the people the care they need. This is about making dental offices stronger than ever. This is meant to be simple, so every dental office can do this, so they can be confident and take their place as one of the most important healthcare providers. Also, before we start, I want to thank all those who have gone before and discovered a lot of great truths, about how our body works. Very important, what we've been able to learn. So I want to make sure that we give thanks. So I wish this slide is all we needed for this event. I believe I should be able to sit down. But unfortunately, we've had this statement for thousands of years. This is an old Chinese proverb that came about, like I said, a few thousand years ago. A superior doctor prevents care, right? This is what this is all about. To do this, we're going to have to screen, right? So a friend of mine told me about a statement a few weeks ago talking about an MD that said, hey, the problem, that I have with you dentist testing is that you are screening asymptomatic patients. And all I can say to that is that's called prevention. So I hope this slide will drive your thoughts and decisions going forward from this place on. But unfortunately, this is our reality. I think this is one of the most brilliant memes I've ever seen. Honestly, I don't know how much more of the prescription ads I can take. That soft voice at the end that says, "Oh, you might experience death or a heart attack." Unless forget about the cost. I mean, what about the cost? Of these two different mentalities. So we have employers all over the country out there trying to drive healthcare costs down. Until this changes, we're not going to get there. So, okay. So dental sleep medicine. This is a topic that I've been very close to, very passionate about for many years. It's actually a term I'm not a big fan of. Funny that I call one of my courses Dental Sleep Medicine Simplified. One of the things I do like it has dental at the start of it, right? That's great. But sleep, obviously, I love sleep. Nobody talks about sleep more than me, but I want it to evolve past that. This isn't just a sleep story. When you start talking about these topics, we're talking about Airway and the TMJ, this is something that has benefits in the day, as well. So sleep, huge part of it, foundation of health, no doubt about it. But we need to start telling the daytime story too. And then medicine, the medicine part of it, it's kind of like we're part of medicine, and we act kind of like, when medicine allows us to do, what we can do so well. But hopefully someday soon, and we're talking about it different, and really what I want everybody to start talking about these topics this is dentistry, right? This is something where every dentist should be able to get involved. And I do think we still need the specialists, that are very trained, just like we have in all the different, areas of dentistry. I think we do need the Jameson Spencers and the Michael Gelbs of the world that are TMJ and Airway specialists. So very needed. Later on, I'll be talking about the model that I recommend. But in reality, this is this is general practicing dentists and MDs driving this, and then referring to those specialists as we need. Also, as we talk, real, this is just another perspective, right? This might be a little different workflow that can be added to the ones that are already out there that work for so many people. But I'm trying to, recommend something that might be a little simpler. I get people ask me all the time, what does this look like? Or what should this look like? Or how do you do it? Or what is the formula? Well, sorry, the formula is actually quite complicated. That phrase, that acronym, I learned from a friend of mine, Dr. Goldberg. But my goal, to be honest, is to not have a formula. I think it should be that simple. But if you do want a formula, I do have one that I can give you. I've used it in almost every lecture that I have given for the last almost 5 years, and it's be the scientist and the subject. This is when you make it personal. And that's the one thing, if there's a single common factor of all the let's just say a few hundred dentists that I think do this very successful in this country, it is personal. And they will go through anything, I think like myself, to make this work. I was going to tell a Tony Robbins story, but I got my own story. Now I can tell. As of this week, Monday, I had this experience. It was very traumatic to me, and I was going to catch a flight to the Denver airport, and I had to return a rental car. And I'll start and go back. It was very personal that I was going to make this flight. Right, this was something that I was flying from Denver to Kansas City, and personally, I was very determined. So I got to the rental car place, kind of got the signs to where the rental cars were, and I couldn't find my car company that I was returning this car to. I went past it. I knew my time was limited, and I finally went into another company's place, and I said, I got to know where to return this car. And they said, oh, you can return that here. And I was like, oh, phew. So returned the car, of course, went over, missed the shuttle bus by a few seconds, got on the next one, got to the terminal, sprinted from the terminal to to the security checkpoint. Luckily, I was TSA pre-check. Went through the pre-check line. Literally was going to be so close. I thought, if this TSA agent doesn't let me through, I'm not making the flight. And I thought, kind of like an MD in some of the ways we do dental sleep medicine. But got through security, sprinted down at Denver. You got to take a train to get to the terminal. Sprinted down. The train was there. Got off the train. Sprinted to my gate. It was the wrong gate. Found out which gate I should be going to, and made it to my gate as the person was going to the door to shut the door. Okay, and I got on the flight, and I was so flustered, and so I was sitting there. I'm like, I got to learn from this. What? And I'm like, oh my gosh, this is dental sleep medicine. It was this. Everything had to align, unfortunately, and so what a personal. I like I said, personally committed. I made it work, and it made me realize, hey, if I'm that good, I was carrying my luggage full on sprint, to the gates. And I thought, hey, I did that pretty well. I deserve to be compensated. So these dentists, my story might change. Some of my lectures, I talk about, let's have some reasonable fees, but the people that end up doing it like we have it nowadays, I think they deserve to be paid well. So anyway, let's move on to the positive, hopefully inspiring part of this event. This is what I'm going to talk about the rest of this night, and this is my attitude going forward and everything I do with products. This is dentistry doing dental things. And so hopefully from this point, if it involves the maxilla, if it involves the mandible, the TMJ, the surrounding muscles, the tongue, the airway, dentistry has a right, and I think a responsibility, to guide, treat, monitor, image, however you want to say it, these areas. This is our domain. because we determine how these areas function. Therefore, we determine how they sleep, how they function, what their quality of life of each and every patient is going to be like. So I hope that all those watching this tonight or whenever will share, do whatever social media people do, so we can start to expect and understand, when these, all of us as people, when we go out to our dentists, we should expect them to understand and be master of these areas. Okay, so I have an image here. This is the upper airway. And I want all to understand that an airway, this is the most important thing that's going to determine how we physiologically function, period. Right? I want all to understand how someone breathes is of utmost importance. Okay? In this picture, we see we see some structures in there, some bony structures. I want to first highlight the maxilla. You see that in green. Maxilla is king in all this. Okay, so we got the mandible. You can see how that's attached to the tongue. So all these features, this is dentistry's wheelhouse. We're the ones that determine how this is going to go. So we need to screen with our technology. Think about the CBCT and the imaging. You can probably look at this image and get a real good sense of how a CBCT imaging can help you guide and make great decisions on this. All right, so this is the TMJ and the surrounding structures, the muscles, the nerves. Picture this sensory information going to the brain. All of this is going to affect how you sleep. It's going to affect how you feel. Right? No other profession controls these areas. This is dentistry's domain. I want people to understand what a huge sleep disruptor pain is. Right? So during the day, these muscles of this jaw joint, we protect them. I've been talking here for however many minutes now. I haven't touched my teeth together once, right? But at night, all bets are off. So if we don't understand what the airway is doing and how the airway is affecting these and how these are functioning, if we can't understand what's happening there, then we're going to have patients with problems. Poor breathing will stimulate a response to make these areas overactive at night. So what we're really doing is we're minimizing nociceptive information that's going to the brain. And you can see in this, not only do we have our information that's coming from the areas of our domain, but we also have sensory information coming up from the cervical area as well. All these are coming together, going up to the somatosensory cortex. So very important that we understand this. Okay, so I have a top 3 list. I wish I was entertaining as some, but I'm going to make a top 3. These are important. So number 3 for dentistry to understand, for me, number 3 is restoring the function and the cosmetics of teeth. Why? Because a beautiful smile is very important. Straight teeth matter, right? We should be able to chew food. We should be able to feel good about our smile. Right? Number 2, we need to prevent infection. Why? A mouth is a huge source of infection. Right? These infections increase the chances of us having heart attacks and strokes. Right? Again, we have the technology to prevent these infections. Right? We have CBCT, we have intraoral scanning that can give perfectly fitting crowns. I think this should be the standard of care. Okay. My number 1 is the TMJ and Airway Health. TMJ and Airway Health ought to be dentistry's number 1 priority. Biggest reason, because the TMJ and the airway are going to determine how you sleep, right? Sleep's the foundation of health. And because this is also going to help you how you feel during the day. And because all the top 10 leading causes of death in our country, I can attribute to poor sleep, poor TMJ health, poor airway health. Our country needs this, but we can't afford these preventable diseases to cripple our country which is what they are doing. Okay, so I want to focus on this tonight, the TMJ and Airway Health, right? I think dental education is where this needs to start. If any school is out there and wants help, obviously let me know. I'd love to get involved. I think the ADA should act like this. They've made some great statements. But for now, this has to start with continuing education. There has to be products that support this priority, for us to make it work in a practice, right? So I think patients need to expect this to happen. I think the staff has to be trained and able for this to happen. Again, share this on social media. That's going to help, so dentistry will start acting like this. But this is about us and the patient. So don't let anyone get in our way. Okay, so what is this going to look like? In an office, like I said earlier, lots of different flows. This is just one option. But again, this flow, I want to keep it simple. I want this to be flexible. Okay, I want dentists to screen. The ADA made their statement on screening for sleep-related breathing disorders. Okay, I want dentists to diagnose within the scope of their license. I want them to treat within the scope of their license. And I want them to screen. And then we need to test, right? There needs to be a lot of collaboration with primary care providers, right? So we're going to test as an option. We're going to collaborate with primary care providers, and we're going to protect ourselves as dentists. But this first part that I'm highlighting on this screen, these are the areas that I'm kind of pointing out to that I'm trying to support tonight. For us, if it's in the TMJ and the Airway and we can do what we can do, let's go ahead and still have the regular flow of testing and collaborating with the MDs where appropriate. This is what I'm adding. Okay, so here's just a basic description of what I'm talking about. This is the vision that I have. Again, I hope that the GP, general practicing dentists and medical doctors are the ones driving this. When we need specialists, let's refer them. Okay, this is not a new model. This is what we do in dentistry with ortho, with endodontics, with other areas. If we need specialists, let's use them, and we do. Okay, so for many years, Ripple has led the way to combine the Airway and the TMJ Worlds. This is a brand I think that's going to support this vision that I have. It has always been about compliance. It's been about comfort. It's been about effectiveness and improving sleep quality. This has also been a brand about lowering the cost and getting more access to care. So I want to discuss some of the unique features of this brand. So I have a video. I'll highlight the video as it starts here. So first, I want you to notice the anterior programmers. So you're immediately minimizing muscle force. You're taking away premature contacts. The design of it, no matter where you bite, it's going to take you to a registered position that the patient and the provider defines. If someone has a suspected airway issue, elastics are going to be added to give the Airway and the TMJ the support it needs. So basically, these elastics are going to guide to an ideal position. But one of the important features of this video of this appliance is this is going to guide, or it's going to encourage you to close your lips. So proper lip seal. This is about proper breathing. So one of the things I'm excited to talk about tonight is we're introducing a new occlusal guard that I'm going to say is the best in the world, a new Airway and TMJ support device, and a tongue trainer. And the coolest part is all three of these are going to be in one system. So we're going to take some of the decisions that happened before the device is made, and we're going to simplify this before the patient ever has to wear it. We will know, we will have the flexibility to make this. So as of 2020, you will be able to offer this to your patients all in one product. You'll be able to send in a lower and upper impression, preferably from a scanner, and a CR bite that's open, and we'll have some protocols that we'll teach on that, and that's it. From that, you will be able to send that in, get the product, a modular product that'll give you the flexibility to adapt to that patient. So the other thing that we're launching as a perspective of the product is this is a full upper airway system. Okay, so us at Devdent, we've had improving patient care is our number one without exception. Our number two has always been about strengthening practices because we know that is going to improve patient care. So again, I want to announce this is our next leap into fulfilling our mission as a company. And I think we're gonna make this all about the plastic because the plastic is that good. So all offices will be able to be confident, jump right in and fill this important role. So here's what the plastic looks like. So like I said, in 2020, dentists will have a full modular system with complete flexibility for the provider and the patient. Not only is it beautiful, but it covers the function. It functions to cover all patients with TMD, and airway issues. So here on this image, you are seeing a receptor for a removable tongue trainer. This tongue trainer will attach to this piece that extends up on the palate, and whether you have it or not, it is still very comfortable. We also have recessed channels in the device for elastics. So if you want to use this as an occlusal guard, you won't have this patient snap in the elastics. And if you do, then they will be using the same device. This elastic will come in many different lengths. Lots of flexibility here again, but very simple for these patients to use. Here's what the tongue trainers looks like. You're going to train, your patient's going to be able to train the tongue to be up and forward against the palate so they can learn to breathe through their nose. Right? Another huge advantage of the system, again, is this is so easy. Let me show you. All right. Well, I was going to show you a great scanning video of an upper and lower arch being scanned with a bioregistration. Should take about a few minutes. Also, we'll have the ability to take traditional impressions. You will be able to send those in as well. What this system is all about is the ability to close your mouth. So what's the advantages of closing your mouth? Oh, there's about a million, right? This is about less hyperventilating. This is about not being hypocapnic. This is about having less upper respiratory tract infections. This is about having the tongue to support your jaw. So no more high vaulted palates. This is about having less malocclusion. This is having proper pH of saliva in your mouth. So if all of the Ripple products now are encouraging you to breathe through your nose and you maybe don't breathe through your nose well, you're going to need a product to help you there. So nasal dilators, there's been lots of those type of products on the market for years. I think a lot of them have their limitations, whether it's adhesive, whether it's putting lots of material inside in the nose that's somewhat irritating. So we're not just at Ripple here. We're not just stopping at reinventing oral appliances. We're also moving on to the nasal dilator market. So we have created the best functioning, easiest to use, and most comfortable nasal dilator on the market. It's beautiful. It's 3D printed. It is clear as glass. So there's, if you look at this image, you're seeing the part that goes across the bridge. It acts as a template, and then it defines the outside position of the cartilage that, again, the provider will define. So no pressure on the septum. It's significantly less irritating, and you just slide it on. So this, in my opinion, this is a great place to start for many that want to sleep better, right? So my goal at Devdent is for dentists to have the knowledge, understanding, and confidence to be experts in the TMJ and Airway world. We have partnered with Henry Schein and Plant Mecca to create courses that are all over this country at a great value. I hope you have a different idea of the role dentistry plays in healthcare. Thanks for watching. Thanks for being willing to evolve. Dentistry sees the population more than any other healthcare provider, so we can make a difference. Our country needs wellness more than ever. Our country needs dentistry more than ever. So go to devdent.com to see our course calendar and to get information about our company. Thank you.